Wait, guys, this morning there was literally a biker gang outside of our apartment building. It was insane.
I know.
It was just like you couldn't walk outside because it like hurt your head.
It was crazy.
When the Uber driver was dropping me off, he was just like, "What the fuck is
Oh my god,
going
you did
on?"
robo-taxi? What happened?
I thought I called it, and then I was like, "When is it coming?" And then it wasn't
never
called,
called.
which is why I was here 10 minutes later than I
Yeah.
said I would be here.
No, I get so stressed about things like that. Like when after I call an Uber, I'm looking at the Uber app until the Uber gets to my house.
One time, okay, so there's been a couple of times where I run down to the Waymo in a robe, open the Waymo door, and then run back up, change, and then go back down.
You're lying.
Wait, I have a better hack. From your app, you can unlock the trunk, and so the trunk opens, and the car can't move if the trunk is open.
Oh,
So you don't have to do that.
Okay, Waymo loopholes. You heard it here first.
This is way better than the robe thing.
You would run down in your room.
No, because like Audie saw me do it, and he was like, "What the fuck is going on?" He was like, "What are you doing?"
I mean,
and I was
we
like,
came to the same conclusion.
I was like, "I can't lose this Waymo." Like, oh my god.
yeah, so if you guys are
so
ever in a
funny.
pinch, you need some extra time.
Yeah.
Yeah.
Anyways, I feel like this week has just been bad.
It hasn't been bad.
Wait, what? Why?
I don't know. I just think that the new year, I'm like hoping things turn around.
Oh, I feel that.
Okay, we can move on.
Okay. Welcome back to Get the Check. I'm Maya.
I'm Annika.
I'm Priya.
And okay,
Whoa.
dog. Just come in my audio, fine. And today our lineup is on a bunch of different things, but we're going to start with healthcare updates. So JPM had their annual healthcare conference in SF. Traffic was terrible. And as a result, OpenAI and Anthropic announced their healthcare products, both for enterprise and for consumers. Next, we're going to be doing an update on the Netflix situation that's happening. If you didn't know, Netflix just entered an exclusive deal with Sony for $7 billion, and they'll get access to stream basically all of their like movies and content and stuff. And the Warner Brothers like acquisition is still going back and forth, and there's been a couple of updates in the last week since we covered it. And then finally, we're doing our Get the Check segment, and we're featuring insurance tech companies for the first time, and we'll go into like how the industry works and then what these companies are trying to do. But
Yeah, we have a lot of different areas to talk about today.
yeah, it was like all over the map.
It was.
Yeah.
There's a lot of context switching, but then it's also interesting because there's so much overlap between healthcare and insurance that I hadn't even thought about before, which we can talk about in the insurance section.
Okay, yeah. Cool. Should we get into it?
So starting with healthcare, all of these big labs basically announced their healthcare products, and it was things that they had already been working on. So Anthropic, for example, a few months ago released Claude for life sciences, and so they're basically building upon that. And then for OpenAI, they were basically saying that we see a bunch of people already using ChatGPT for health use cases, and so it made sense that they were going to go after that vertical. It's a huge opportunity because healthcare is not only a huge market that's always needed by people, but the vertical AI market for healthcare has also been the most successful vertical AI market thus far. And so it makes sense that they're taking the opportunity to get into the space.
Yours truly works at a competitor.
Yeah, and we have two healthcare experts in the room with us today. So this is exciting.
I wouldn't call myself an expert. I am just learning the industry because it's only been a month, but Annika knows a lot more.
Yeah, and I feel like I only know things from talking to the two of you.
Probably from me complaining. Yeah, so OpenAI announced ChatGPT Health, which everyone's already been using it for. 230 million people globally ask health and wellness questions every week. I'm probably in that category myself. And
Wait, me too. You know, I actually like have diagnosed things about myself because of ChatGPT. Like I'll take pictures of my eyelid and I'll be like, what is this dot on my eyelid? And then it's like, oh, that's milia. And I was like, I've never heard about that in my life. And now I'm going to the dermatologist to remove my milia from my eyelid.
Yeah,
I
that
got
makes
Amelia
sense.
in high school, I remember, because whoever I went to thread my eyebrows was like, oh, that's Amelia, I can remove it.
But yeah, so they entered into healthcare for consumers, and they actually I feel like it's the first vertical that they've carved out for consumers. Like if you think about it, like everything else has just lived with inside the chat tab, and now they have a separate health tab where your conversations, your files are stored separately from your chats, and you have like different context in that, and that's mainly for like privacy concerns.
I was gonna say, yeah.
Yeah, free users don't want like OpenAI to train on their data, and so as a result, OpenAI wanted to carve out like basically a separate tab for it.
I was curious about this because OpenAI must have been training on everyone's health data this whole time, right?
Yeah.
And so it's interesting they made this decision because it limits like their own training data.
I don't know. This is just my hypothesis. But if they want to build better answers, they need content partnerships, which is like partnerships with like the medicine journals and stuff like that. And in order to build those partnerships, they need to make a separate concerted effort to go after healthcare for consumers, because the content partnerships actually feed like real data of how you should treat things, and it's better than like WebMD or whatever you can scrape online. And so, in my opinion, I think the reason why they had to do this separately could be one of two options, which is the content partnerships, and the second option is that like maybe they want to go after like a HIMSS and HERS model where they start to become the referrer for different drugs, and that's another way they can make money. But in order for them to do that, they have to be HIPAA compliant.
Part of this is that they're partnering with other brands and companies like MyFitnessPal and Apple Health and all of those. Yeah. And I feel like doing that, I'm sure they have their own set of regulations similar to what you're saying of you have to have it in some
your data needs to
place.
be like encrypted essentially.
Yeah.
And like we can go into like HIPAA compliance, but the basic idea is that you have governance over your own data about yourself, and it's encrypted and it's stored, and it's only shared if you like allow your data to be shared, or if it's like with a trusted doctor or a trusted source, and it's not like leaked to the public where people can use it for malintent against you.
In terms of looking at the outputs that they're providing, they did get actual physicians to look at all of the outputs, and there were 600,000 reviewed outputs from their model to basically confirm that everything that they're saying is accurate, because we know that one of the biggest issues with healthcare are hallucinations and giving like incorrect information.
Yeah, and these are the job postings that you see, like Mercor, for example, a lot of times posting where they need investment bankers, they need physicians, all these skilled professionals that get paid pretty well per hour.
Yeah.
Reviewing this. And yeah, it was interesting to me that logical, but also interesting that OpenAI went consumer first with this, because that has been their approach to everything, and they obviously can capitalize on the consumer base that's already using this for health. And then they also had an acquisition of Torch on the 12th, so like 6 days ago, a few more once we release this, for $100 million. And they're a really small team of 4 people.
Which is crazy. Sorry.
Yeah.
Well, you know, my dad texted me because like he knows you started a new company or a new job at a healthcare company, and he was like, "Wait, was Torch the company that Maya joined?" I was like, "No."
That's so funny.
Maybe I wish, bro. Like, I mean, they probably made a bag, but
For sure.
Yeah.
And it basically combines all of your information, which is the exact same thing ChatGPT Health is trying to do, from your wearables, your lab tests, other portals, doctor visits. And that's similar to what ChatGPT is trying to do. Like one of their integrations is BeWell, which enables you to basically get your own healthcare data in one place, whether that's like your records, your lab results, even like providers that you've seen, your insurance benefits. And basically Torch was considered a medical memory for AI and was like trying to unify your records. So the acquisition makes sense. It's kind of like an acqui-hire because they probably also just wanted the 4 people that were on the team.
Yeah.
And then, yeah, that team came from Forward Health, which shut down in late 2024 and was trying to create like an AI-enabled doctor's office, but their unit economics just weren't working out. But it's really funny because in 2024, I think in the summer, I don't remember exactly, like me and my friend were at the beach and we were just like spending the day at the beach. And it was a Sunday, and this guy was on his computer, like trying to get Wi-Fi at the beach, which obviously you can't do. And he was freaking out about it. And then my friend was like, "Oh, you can use my hotspot." So then he was like trying to use his hotspot, but it wasn't working. And we were just making conversation standing there. And me and my friend were both in healthcare too. And this guy was like, "Oh, I'm in healthcare. I work at Forward, like blah, blah, blah." And was telling us about it. And he was so panicked about work. And he walked away and we were like, "Oh, like a healthcare startup working on a Sunday, like they're going down for sure." And then like a few months later, it closed.
Cool. So the second part of OpenAI's release is that they're going into healthcare for hospitals. And so the idea is that hospitals can use like OpenAI's products within their systems. Currently, the information that at least I have is that they have no official content partnerships with any of the medical journals, which means like they might not be going after an Ask product specifically, but they are partnered with the top 8 hospitals, but they only have 1,000 seats at each of the 8 hospitals, which means less than 1% of the doctors doctors can use these products. So it's not really rolled out to very many people. I mean, that's like 8,000 users. And then the other thing is that they're going like top-down approach rather than bottoms-up approach. So signing the agreements directly with the hospitals and then working with the doctors rather than going straight to the doctors.
Which I think makes sense because they have much more of a brand name than like Open Evidence when they started their go-to-market motion.
Yeah, for sure. I think other people that are known for going after this approach is like, for example, a Bridge.
It also feels like it's something they probably have to do, because if you look at any of our companies, like you have to use the enterprise version of something to make sure all the data is secure. And in the same way that doctors are already using ChatGPT for things, and so it makes sense for them to target those people first and then like go after other people.
Yeah, it's interesting because they're going top down, but they've kind of already gone, like they've already gotten the bottom layer. Like most doctors probably do use, or a lot of them probably do use ChatGPT. Like I've seen my doctor use ChatGPT.
Yeah, and they probably weren't supposed to use it. I'm sure they're not saying your name or anything like that, but I'm sure they're not supposed to be doing that. And so by creating this enterprise version, even if they're not making a super big push into that market, they have a product that exists for that use case.
Yeah, I think the only question with this like go-to-market motion is that's just like the long tail of healthcare. Like, yes, you can go after the top 8 hospitals, but like there are so many states that are just basically private practices. Like if you look at Arizona is so fragmented. And so when you're thinking about getting adoption across the entire US, it's just way harder.
Yeah.
And you can see it also in like the slowness of like the healthcare tech companies too.
Yeah.
And how they've grown.
I honestly just don't think it's a huge focus for them. Like I think it's something that they needed to build to appease this some amount of doctors that are using ChatGPT that wanted to use it at the hospitals, and it's a good product offering to have. But it doesn't feel like they're putting a lot of emphasis behind that, and it very much feels like they're focused on the consumer version of it.
Well, I just think it's probably like a 10-person team at OpenAI, and that's like what their job is to do. But like OpenAI itself isn't actually going to care about it too much. And like this is where I think focus matters for OpenAI. If you're like thinking about it like long term on like what is OpenAI trying to do? They're trying to make enough money to cover their assets for all the debt that they have, and like and so like they're literally going to shoot darts in every direction, right? But the question is like,
I mean, that clearly is what they do.
Yeah, right? That is what they do. But then like I would argue, if anything, like they should just shoot less darts and like think about their spend.
Well, I think we should talk about
really salty right now.
Sorry, I just like have to be, you know, like I'm paid to be this. So.
Well, I think we should talk about Anthropic's approach because I actually think Anthropic's approach seems like they're already deeper in the healthcare ecosystem, not in the part that competes with open evidence. So no, I can be less salty.
Oh, I mean, in the part that actually helps open evidence,
like in the research
like
and all of that,
like the agent skills. If we use like Anthropic's models underneath, and those models have like these agent skills,
and they're better than
like integrated. Yeah.
Well, we can get into it and explain it.
I see what you're saying. So basically, Anthropic announces Claude for healthcare, and they had already announced Claude for life sciences, as Priya said. So for Claude for healthcare, my perspective is they're really going after the enterprise layer and the administrative layer. And this is something I think about a lot with healthcare costs. So the country spends $5 trillion a year on healthcare. Like I think it's 5.7, which is insane. It's like a substantial portion of our entire economy. Out of that, 15 to 30%, depending on how you define it, are administrative costs, which is just all the paperwork, all the faxing. Like Maya was just talking about working on a faxing product for work. Faye has a faxing product too. Like not even going into specifics, it's just like every health tech company has a faxing product because insurance companies, doctors, like they communicate via fax like to this day. And there's actually the first time I had to send something over fax for work.
I remember when you had to do that because you were like, I have no idea what to do.
And I went to UPS and the guy was like, oh, are you like actually wanting to fax something? And I was like, yeah. And he like had to figure out how to do it because he was like, no one's ever asked me to fax something. And then he was like, this is going to cost you $20. And I was like, I don't care. Just take my Ripley.
Wait, you know you can just fax stuff online?
Yeah, so I realized that after, and that's what we do now. But this is like the very first time. Yeah, you can just use Documo and like other software. I know. Yeah, this is like a long time ago, but yeah, maybe. No, so that was a mistake I made at work in retrospect. But
yeah, by the way, the reason why people fax all the time is because SMS and email are not secure modes of like transferring data from one place to another, and only the phone line is. So sending a document over the phone line is like one of the few ways to transfer data or like PDFs. And that's why people use fax. Because it's like going over the phone line, which is like encrypted, but like SMS and like email is not. Okay, we digress. We have to get back to Anthropic.
Okay, so basically they're selling different admin products like prior authorization, coding, claims, ICD-10 data, which like I want to break down what that means because if you're not in healthcare, it probably doesn't sound like English. A lot of times before you see a specialist, you need prior authorization that like you actually need to see that specialist.
It's just like a paper that's like, yes, insurance will pay for this service.
Yeah.
Or this like drug. That's like the best way to describe it. Yeah.
Or sometimes you need like a referral. And then what providers submit to health insurance companies, so like doctors submit to like United Healthcare, is a claim. And so it has like all your information, like your name, your address, and then it has like, it's basically coded. So it's like there's a code for like the type of service, then there's a code for like essentially the illnesses or diseases that you have. And then there's like different adjustments to the code. Like it's like anything. Like it ends up being more complicated than you'd think.
It's so complicated.
It's really complicated.
Yeah.
No, that's like basically the part of our company that I owned until like recently.
Oh, really?
No, it's super complicated. Like, and there's a ton of money to be made in it because like around 10 to 20% of all claims filed get denied.
Yeah.
But
Because
it's
of
not
the
even
code.
as simple because of the code, or it could be about anything. Like, and we'll get into this, but it could be like the provider wasn't eligible, which is related to checking the provider's like NPI number in the data in their database. So that's like another integration that Anthropic announced. There's like all these different things. Like they announced an integration with ICD-10, which is like related to coding, with the NPI database, which is related to the provider. So it's like all of these integrations, and there's a ton of money to be made in it. FHIR, where I work, built out everything in-house. Like we use our own EHR system, which is really insane.
Is that Epic? Like Epic would be the competitor for that.
Yeah.
Okay, I was
like,
reading about that.
Yeah, like we just built it ourselves. But then like
Wait, isn't that crazy? Because doesn't everyone use Epic?
it's like 50% of people.
Oh,
use
Yeah,
it.
but then it's like the same long tail thing where it's like if you don't use Epic, then it's like super fragmented and all of these like little EHR systems. That's why like EHR integration is like tough because it's not like 90% of the market uses
One
things.
thing. Yeah, got
like,
it.
Yeah, and I think that because nutrition is a more simple use case than like surgery or some of these other specialties, we decided to build it in-house. But had we not built it in-house, there's like Candid Health, which is like a Series B, Series C, like fast-growing health tech company, like similar DNA to like a FHIR or like a Nourish. And that's what I think Nourish uses. So like there are a lot of people that use a third party, but even then like we would have never used Epic because Epic's just like too legacy for like a company like us to probably want to use.
Epic resolution is literally like 420p or something. Like when you like use it on your browser, it's crazy.
Really?
No, it like literally looks like you're looking at a pixelated screen.
Yeah,
Wait,
it
I feel like
does.
that's what you see when I go to the dentist, and they have the super like it looks like you're in the 2000s.
Yeah, because you're Well, I mean, the other thing is like all the incentives don't align. Like the insurance companies are incentivized to make prior auth hard, right?
Yeah.
And so, but the one thing I wanted to say about like the prior auth skill is I think like the first draft of the letter can be easier, but a lot of the prior auth headache is like the doctor actually getting on the phone and like talking to someone on the other side. So like what'll happen is like the doctor will submit the prior auth letter, the nurses and like hospital staff will like work for that prior auth letter on behalf of the doctor for a long time until the insurance company comes back and is like, no, you need to get the doctor involved. And then the doctor has to like take these phone calls, and that's like a large part of their time. It's good that that first step is being solved for, but if you think about the whole prior auth lifecycle, I would say a lot of the time is spent at the very tail end of like really trying to secure the close. It's like with any deal, like at the end of the day, you have to like, when you close a deal, you're spending a lot of your time at the end of it, not the beginning of it. So
That makes sense. And OpenAI also mentioned prior auth as something that they're automating, but then Anthropic went more in depth and they announced they're actually having like healthcare agents that are connected to every platform you need. And so prior auth, I feel like, was the big use case that they said their agents can do.
Yeah.
And there were a few other things too, like claims appeals.
FHIR too is like a big deal.
Yeah.
Yeah.
So FHIR is basically like the protocol for sharing your healthcare data. So your healthcare data is like formatted in this like specific way, and it's like the standard is FHIR, and it's so that like you can transfer data from one system to another easily. And so like Claude can now, I think, pull your data via FHIR if you give it like access. Except I saw a couple tweets that it doesn't work well.
They're working on it. It's in
They're
progress.
working on it, yeah.
Yeah, it'll be interesting to see how all of this works. And I also feel like healthcare is not going to be a quick adopter the way like software engineers were with Codex or Claude Code.
Yeah, I also think it's interesting that Claude for healthcare is also focused on the research side of things. Like, it's not only for the payers and the patients and like all of these people. They also are going into drafting like clinical trial protocols and operations, and even some of the Claude skills that you guys were talking about that are helpful on like the payer side. They have single cell RNA sequencing and things like that, which is actually really cool that they're able to provide more to the research end, because I think that is a much easier thing to adopt than maybe integrating it into some really complicated healthcare system. And so I think it's something that could help increase research, speed up research, and also like decrease research costs, because we're really bounded by research grants at these like universities and funding and all of these things. So I think that it's cool that they're also focusing resources on that.
On that topic, apparently scientists who engage in AI augmented research publish 3 times more papers and
Whoa.
receive 5 times more citations.
That makes sense. That makes sense. And I think it's cool. Like, the more research you have out there, the faster you'll get to conclusions on things. And yeah, it just like supports that entire community.
Yeah.
When people talk about the risk of AI, I actually think the risk of AI being involved in research is way scarier than in doctors' workflows, because
The lack of creativity.
it's not just a lack of creativity. I feel like anything that involves writing obviously lends itself to AI slop. AI slop with a research paper is concerning. And I remember when looking at some of the nucleus genomics stuff, that was one of the big critiques, was like, this entire paper is AI slop. And I do think that'll be an actual issue the research community faces.
Yeah, but I think there's like a ton of checks and balances though with the research community. Like, you have to go through so many peer reviews to be able to like get a paper actually published.
And there's checks and balances in like actual clinical studies and trials, like the actual doing the experiments.
Yeah.
But I still think that
Well, I'm not like
it's
against
better.
using
Yeah.
it. Like, I'm not like against using it. I just think if you think about AI slop permeating like everything, that is an area where I would be like, that is kind of concerning to me. But yeah, I agree with what you guys are saying too.
And then the last thing that came out with the Claude for Healthcare launch was that they also partnered with Microsoft Foundry, who already has a ton of super deep enterprise relationships with Stanford Medicine, Johns Hopkins, like all of these universities. And so we obviously know that Anthropic is going after the enterprise approach and layer, but I do think that all of these partnerships and integrations makes it even easier for them to integrate, because they're already on Azure. Microsoft is already working with them, and so they can just start integrating it immediately. So I think their go-to-market motion is pretty solid for getting into the space. I guess one thing that I'm curious to get your guys' takes on, because you work in healthcare startups, is what do you think that this means for healthcare startups?
I think it really depends on the healthcare company. I think there's a section of companies that are involved with something physical or like wearable that this actually helps. So like Function got a shout out from both the labs in their press releases, which is like huge. And they do blood tests and stuff like that. And then even something like Aura, like all these things where you'd be connecting data from wearables or tests or anything like that, I think are making a lot of money. I think, what's the place everyone goes to get lab tests?
Quest?
Yeah, it's not a startup, but they apparently are printing money.
Yeah.
Then there's another set of companies that have been tackling this very thing of like healthcare admin work, which is like, I'd kind of put Open Evidence in that category, a Bridge in that category. There's other ones too, like Ambience is a big one. They all take a bit of a different angle, but I'm interested in your take, but my take just from talking to people at these companies is I feel like they're all trying to go more horizontal. Like Open Evidence started with basically ChatGPT for doctors and is trying to go more horizontal, it seems like, based on what you just said. A Bridge, I know for a fact, started with like AI scribes and is trying to go more horizontal in terms of like, okay, if we have all this data on people's appointments, how does that affect what gets put on the claim for billing? And we just talked about how like the claims process is so complicated, and if you have all this evidence from the chart notes, you can even create like some of the documentation. Like they're trying to all go horizontal, which also seems like is what OpenAI and Anthropic are doing.
So my take on everything that you just said is that like on the consumer side, it's a lot more clear how this plays out. ChatGPT having a consumer health product connecting to all your data, similar with like Anthropic doing that as well, makes sense, right? Because like patients and consumers want to be in charge of their own data. They want to, and they use a variety of tools to like understand themselves and their own body. And then having one thing that can use all of that data together and help you as like your personalized AI doctor, like that seems very clear. That seems also very in line with like OpenAI's consumer approach. I could see even like Apple kind of getting into it at some point too. I think on the enterprise side, where you're like doing tooling or admin work or helping doctors in some way give better care to patients, there's two different approaches. You can go and sign contracts with the hospitals directly, or you can do bottoms up. And like if you're like, how do you take someone out like Epic, like like for example, like a bridge, right? Or any of.
Do you think they're trying to take Epic out or just be integrated with them?
I don't think anyone's first goal is to take Epic out, but I think everyone's like ultimate goal is like, how do you become an Epic like competitor where like
that makes sense.
It's a better
that's not like OpenAI and Anthropic's ultimate goal.
Yeah. And I think that's where it's like, okay, what's the better way to go about this? Should you be bottoms up or top down? And it just seems, at least to me, obviously this is going to be biased because I work at Open Evidence, so like my take has already been clear, and hence why I joined the company. But bottoms up is better, right? When doctors have control over the tools and products they use, they can be a lot more efficient. Like for example, doctors talking to, like, let's say a doctor is giving care to a patient and they want to talk to another doctor who's also giving care to that patient. If they're not in the same network or in the same hospital system, it's extremely hard to get a hold of that doctor. If you're, you know, like let's say the heart doctor and then the brain doc and someone else is the brain doctor and you're both at Kaiser, you're at the same hospital or whatever, you can talk easily, freely through the chat system that in your EHR, right? But if that brain doctor is at a different hospital in a different EHR system, communicating is very hard. And so sometimes you need to, like, to give better care, you need to have a full picture of what the patient looks like, right? Same thing, I mean, this sort of problem like repeats itself in different flavors when you're thinking about like prior auth and billing, for example. Not everyone has a full picture of what's going on. And so like the fragmentation leads to a lot of inefficiencies in healthcare because the government doesn't regulate it. Like if you look at other, like if the government regulated healthcare the way that like European countries do, your data's all in one system and your doctor knows everything about you, you know? It seems like Anthropic and OpenAI are going top down, and my take is that bottoms up is better in terms of that space. But yeah.
I don't see a clear answer right now. I also think it depends on what part of the product you lead with. Like I feel like bottoms up for Open Evidence, where it's like the doctor chatting with AI, like makes a lot of sense because you want so many doctors to be using Open Evidence that it's like a no-brainer for the hospital system. Some of these more operational things, you have to use what your hospital is using, right? I don't know the exact rules, but it's like, I'm pretty sure if you're a doctor and you're using an AI scribe, like you need to use your hospital. Like for example, our providers at FHIR, if they're using,
like our doctors use our scribe
and then just like upload the notes.
Yeah.
Oh. See, but like I feel like long term, wouldn't you want it all like integrated?
Yeah, you do. Like that is like the number one request, is that they want it all integrated. Like doctors on our app, right, are like using also our scribe, also our dialer to be more efficient in their everyday. And it's like the question is like, are they going to adopt the thing that the hospital says that they have to adopt? Or are they going to adopt the thing where the app that they open every single day and ask a bunch of questions to also has all these other features? You're basically just like making the bet that like if you tack on like these tools to the main tool, I honestly think the difference between one scribe versus another scribe is like quite minimal.
See, I guess what I'm saying is I don't think it's about the scribe. I agree which AI scribe you use, like doctors don't care, and at the point that you have an AI scribe product, it's probably good enough that a doctor is happy with it. It's kind of like saying, do the three of us have a huge preference on what software to use for meeting notes? Like TLDR, no.
Yeah.
And I mean, sure, you might have small preferences. I think it's way more about who will successfully go horizontally. And I could see like Open Evidence being sticky because doctors already like them. I could also see a bridge being really sticky because if they're like integrated, which I'm not comparing to Open Evidence because I don't know your level of integration, but like for example, if a bridge has a contract signed with the hospital, so they're like integrated as the scribe note, And then they start telling them like, oh, we can actually check what you're putting on claims against the scribe note, or even like pre-fill claims for your providers based on our AI recommendation. Like, I think that will be really sticky for providers. Like, if a doctor knows the first pass of my claim will be done if I use one scribe versus the other scribe, then it's like sticky, versus if it's just the scribe, I don't think it's sticky.
But in those situations, like, a bridge has to learn how to become the EHR to some extent. So what's happening right now is that each EHRs are not incentivized to work with AI companies, right? Because like,
aren't Epic and a bridge are integrated, right? Isn't
yeah,
that the
they
whole-
are.
Yeah.
Yeah, they are. Like, I would say like long term, if you think about it, like they're like, unless there's like some sort of like revenue share, Epic would rather build AI products in-house than be like integrated with a bridge, right? Because if they house all the data, if they own the data, they're going to want to own the application too.
I feel like that's easier said than done, because it's like, why did they integrate with a bridge then?
But a bridge doesn't like, has like 4% penetration amongst doctors.
But like, why would Epic even partner with them to begin with?
I was under the impression that Epic is like trying to back out of their partnership with the bridge.
That is very possible, because Epic just launched their own AI scribe note-taking thing.
Wait, so are doctors allowed to just use any of these tools? Like, any doctor can use open evidence even if no one else at their hospital uses it?
They have to sign a BAA, like, which they can initiate that process. But
Okay.
essentially what it is like, if they want to use like these tools,
Like a
so,
third party tool.
yeah, like the BAA is like saying, like, I don't know how to say this like the best way, but essentially it's just like guaranteeing that we're keeping your patient data safe.
I see. Like, I feel like at our companies, for example, you have to use enterprise versions of things and you're not allowed to put data anywhere else. But it sounds like for doctors in hospitals, they're allowed to use any product they want as long as they sign this form.
As long as their hospital signs the form.
Their hospital. Okay, so their hospital signs off on it.
My closing thoughts are, I also saw a lot of people trying to clickbait it online by saying that Anthropic and OpenAI are trying to replace doctors.
Oh, yeah, actually, I wanted to talk about that too.
Yeah, I just don't think that's true at all. Like, I
Yeah.
feel like
Yeah,
they're
I
very
agree.
clearly trying to target admin work. Although I do think at some point in the future, like, ChatGPT Health can be translated into like your personal AI doctor. And I could see a future, I said this in my TikTok, but I could see a future where you can calibrate your own doctor. Like, if you think about a doctor on so many different dimensions, like, one dimension is how likely they are to recommend medication to you. Like, I've seen doctors that are like, oh, I could prescribe you antibiotics for this, but like, they literally will tell you like, my philosophy is to avoid doing this unless absolutely necessary. Some other doctor will tell you something else. In ChatGPT, like, you could probably make that personalized to you within the range of what's still like healthy and reasonable and like not a huge liability.
Yeah, like there's guardrails. There's guardrails in place,
Yeah,
but
like,
you
it's
can
not
adjust
gonna like
it.
be an anti-vaxxer, but it's like, you could have a preference to get like every vaccine possible. Like, I want to make sure I get my flu shot every year. Or there's like adults that are like, I actually think I'm healthy enough that I don't need that. Because to me, it's like, why is my doctor just a reflection of their own philosophies and not a reflection of my philosophies when it's my health?
Yeah, I see what you're saying. The thing that I'm worried about though is that like ChatGPT, like, do they have that type of control? Because like there's been like many news reports about how like ChatGPT has suggested a dosage to someone, and they've like followed that dosage and then like they've like died as a result.
Nope.
And so
What?
yeah. Well, like a lot of people seek medical advice from ChatGPT, and it's like it can be wrong, and that wrongness can lead to death. And like the thing is, when it's a doctor, I think this is very similar to the Waymo debate, where it's like when it's a doctor, you have someone on the other side that's like, you can sue, right? You can sue the doctor. And like a large part of like hospitals expect their surgeons to get sued X amount of times in their lifetime or whatever. And like the job of the hospital is like to protect the doctor. And when it's AI on the other side, then what do you sue? The engineers, the model trainers? It's like similar to like a Waymo. When a Waymo like finally like, maybe kills someone, like who do you sue, right? And so like,
Sorry, it's
Has
not
a Waymo
funny.
not killed anyone yet?
no,
it hasn't.
Because like when
That's kind of crazy.
Well, when Cruise like dragged that woman, they were like completely taken off the streets, right? So as soon as they mess up,
I don't think Waymo though will get taken off the streets for killing one person.
I think like
Did
there
you see
definitely
when
would be
they-
a pause.
They killed that cat.
They killed a cat.
Yeah, it was a whole thing.
Oh, I didn't know that.
It was really,
People were
it was
really upset about
yeah,
that.
yeah.
Humans would have killed like hundreds of cats.
No, I know.
No,
Yeah.
humans are
Like,
terrible
there's so many
drivers.
tweets that are like, how do people weigh the guilty conscience of replacing a human worker by getting into a Waymo? I'm like, every time someone makes a choice to get in a Waymo over the course of your life, you're genuinely saving lives.
Yeah.
But anyways, is that true for ChatGPT? I don't know, right? It's not clear.
If I had to make a bet on if ChatGPT or the average doctor in America is more correct, like someone was like, you need to blindly take medical advice from one or the other, I would genuinely take ChatGPT. If you go on any Reddit thread about anything, they're like, this doctor said this to me, this doctor said. Doctors are wrong all the time.
Yeah.
Or
No, I
people are
know.
like, I've had something for 10 years. Like, no, like, I agree with you. I think it ends up happening both ways. It's hard to quantify. Like, we're not the people to, like, quantify who's more right or wrong. The point at which doctors are out of the loop, like what I'm talking about of, like, an AI doctor, I think it's very far in the future, to your point. Like, I don't think we're even close to there yet because the bar for hallucinations is going to be way higher than it is even with humans.
Yeah. Okay, cool. We're moving on. So the next story is on Netflix. So recently Netflix signed a global Pay One licensing agreement worth $7 billion for Sony films. Pay One rights basically means that they get to stream the movie first after it comes out in the box office. And so, like, yeah, you might see Spider-Man in the theater and then, 5 weeks later it comes out on Netflix or something like that. So now they have those rights, and this is global, so it kind of extends from now just the US to their entire catalog. And something to note is that actually, like, Netflix is growing internationally and focusing on their international expansion. This is pretty big, and the Sony titles are Spider-Man mainly, Legend of Zelda,
Some other big ones.
K-pop Demon Hunters.
Yeah, and getting those Pay One like licensing agreement is like super important because it's the most valuable time that you basically any of these streaming services could have access to something because it's nowhere else. It's only there and it's right after it's released in theaters. And then Pay 2 refers to cable or something like that. And it's way less valuable. And even Pay One over the years, I think last time Netflix and Sony did the deal, it was around $2 billion or something like that. And that was 4 years ago, I think. Yeah. And so in the last 4 years, it's already increased so much in the value of having access to this.
I think they pay almost like 3x of what Disney pays for Pay 2. And the reason why Disney wants Pay 2 is because they want to build out their entire catalog. So when you're like, oh, I want to watch the MCU entirely, like you can go through Disney and watch all of the old movies. Yeah. And that's kind of what Disney is banking on. But Disney originally had, I think, the Pay One rights, and now Netflix won the deal over Disney. So that's like pretty big.
Because Netflix is willing to pay up.
Yeah.
And no one else is.
Yeah. But I actually did some math. It's been a while.
Oh my God, I love when Maya does math.
But I was like $7 billion. That's like a large price tag to pay for these. And I was like wondering
for Spider-Man.
And I was wondering, like, how do you think about paying for content in the context of Netflix, where like you watch and like, so do you think about it as like how many times people watch a movie? And actually the way they grade it is like how less likely people are willing to churn. If someone watches one major movie a month in Netflix, they're 50% less likely to return or to churn. Yeah. And so like if you're like, oh, Spider-Man's here, then I'm gonna watch this movie, and that one movie is like worth them
paying for the subscription.
Yeah. And so
that is actually how I think about things.
Yeah. And so they're just basically trying to prevent churn. And so if you're looking at this over a 5-year timeline, the break even is that they prevent 3% churn. And for them to be profitable on this deal is that it prevents 5% churn. And this is not even to account for like bringing new users onto the platform.
Yeah. So it makes sense for Netflix to do it. And then from Sony's perspective, they don't have a streaming product themselves. So they're not like, I don't know, HBO or it's not HBO. Who is it?
HBO.
Who owns HBO though?
Warner Brothers.
Oh yeah, like Warner Brothers or any of these other people that have their own streaming service, they don't. And so their only play is that they need to be able to monetize their IP without having the customer. And so it's how do you do that? Who has the best distribution? And it makes sense that they went with Netflix.
Yeah. Netflix and Sony have like this interesting relationship because I think Sony really wanted Netflix to pay up. So K-pop Demon Hunters is like this big story because basically a couple of...
Did you watch it?
No, I haven't watched it. Have you watched it?
No, I haven't watched it.
I feel like it's not something I would watch. But people are saying it's like...
If any of us would watch it, it'd be you.
Yeah, I agree.
That is true.
It's like true. You, then me, then Annika.
Yeah, I'd never watch that.
But they're saying it's like literally next gen's Frozen. But I didn't
That
even
does
know this.
not make me want to watch it.
But it was Netflix most watched movie.
Yeah, it's crazy.
That's crazy. I didn't
Should we
even
watch it today?
I feel like I have to
No.
watch it though. Now it's most watched movie.
Guys, we're having a slumber party at a hotel today.
I'm actually really excited. I kind of want to order room service. Is that allowed?
Yeah.
Not with our calorie counting.
not with our calorie
It's
counting.
not even about the money, it's about the calories.
Yeah.
Maybe we can get one egg to share.
Maybe this will be what helps us learn how to budget, is that we can't eat anything. Oh God, don't cancel us. We're just trying to be in a healthy deficit.
Dude, it's crazy. I can't eat anything.
Yeah. No.
I
Wait,
hate being short. Wait, you can eat.
I
I'm
told
sorry.
you guys my life is going horribly. This is just one more thing.
No, the difference in what me and Priya can eat is 500 calories. That's crazy.
I don't think you guys are using the same underlying calculation to get
We're
to-
using the Aura
We are.
ring.
We're using the Aura ring. Yeah.
Oh.
Yeah, like it is standardized. Okay, anyways, K-pop Demon Hunters. So basically, a couple of creatives are like, we're gonna make this movie. Sony's like, sure. And I think it only does like 20 million in like the box office or something for Sony. And Sony's like, yeah, it's flop, blah, blah, blah. Netflix buys it for a really cheap price, and then it ends up being the most watched movie. They think that Sony should have like asked them to pay like $1 billion or $2 billion, like just on this like one movie alone. And the reason why it did so well is because it's like part of like the K-pop era. Korean culture is just like doing really, really well. Like when you think about music, when you think about movies,
Yeah.
like, and so going into the kids content makes sense. And so Sony just made the wrong bet. And so I think like Sony is like, Netflix, you got to pay up to some extent. But Netflix also really likes Sony's content. So yeah. But we can go on also into like a breakdown of the Warner Brothers deal. So separately, Netflix tried to acquire Warner Brothers. We talked about this, I think 2 or 3 episodes ago, maybe 4 episodes ago now.
This is on December 5th.
Oh, thanks
Oh,
for the
okay.
day.
Yeah. Wow. Okay. Someone took notes.
No, the Netflix Warner Brothers deal was announced.
No.
I was just trying to like let people know how long ago it was.
But yeah, there's just like this whole fight between Netflix and Paramount because Paramount wants to buy Warner Brothers, and Paramount is claiming that the board of the directors took the worst deal and that they took Netflix's deal, and Netflix's deal is arguably worse since Paramount's deal as it like has like a higher value to it.
Because if you look at like the stock price that they were willing to pay, they're willing to pay more. But then there's also certain things that they want that Netflix isn't getting. So it's like there's like a lot of small little details.
And it's actually hard to compare the two offers, but the biggest thing that Warner Brothers has said is that they're worried that like Paramount actually can't pay up.
Yeah.
Like they won't actually be able to pay this price. But
Yeah, the board was apparently calling them high levered and risky. I was like, that's tough.
which is like
Well, okay, yeah, because Paramount has a $14 billion market cap and is attempting an acquisition worth $95 billion.
and the only reason they're able to do it is because Larry is backing
Yeah.
them up. So
Yeah.
Paramount is run by
His
David
son.
Ellison, his son, and Larry is stepping in and giving a bunch of his own money towards it.
Yeah.
But you know what's crazy? So Larry Ellison started Oracle and is a huge stockholder in Oracle, obviously. And since the Netflix deal was announced, Oracle is down $336 billion in total market cap.
Wait, that's kind
Wait,
of
this is insane. Like Larry Ellison just said he'd pay the $40 billion.
Yeah.
Yeah.
Why doesn't Larry Ellison just buy it at that point? Why is Paramount? He's like gifting his son Warner Brothers.
No,
Yeah.
literally.
It doesn't make
Literally.
sense.
Wait, this is like the craziest way to nepo baby.
Yeah, no, it is. And then in response, Netflix is also now saying that they'll do an all cash deal.
Or that's like the rumor.
Dude,
The
Netflix
rumor.
is
The
probably
rumor.
clowning them so hard.
Yeah. But the reason why Netflix wants to do the all cash deal is so that it gets done faster.
Yeah.
They want to move the shareholder vote up.
Yeah, as soon as they can.
Yeah.
That makes sense.
But then what's interesting is that people thought that the Paramount deal might have an easier time getting regulatory approval, especially because Larry Ellison is Trump's friend.
Yeah.
But then recently Trump bought, what was it, $2 million?
Yeah.
Dude, how does he get in the middle of everything?
Everything.
I was like, what? Why do you need to be a part of this story? And he's here.
Yeah, of like bonds of Netflix and Warner Brothers.
Yeah.
Yeah.
And then people were like, oh, he doesn't actually have any say in how his money is spent. Because he's supposed to be divested from his own investments.
But then still, like,
No, yeah, it doesn't matter because even if you are divested from your own investments, you still know what your investments are. So like, like it doesn't work. Like it only works to prevent insider trading, but it doesn't work to prevent like
The
regulatory
FTC,
issues.
from doing something. Yeah.
anyways, still unclear if the FTC is going to block the deal or not.
Yeah.
And then he said, when asked about Netflix's deal to acquire Warner Brothers, I'll be involved in that decision.
He said that.
Yes. I'm going to start saying that when people bring things up, like at work.
Yeah.
So funny.
Oh, wait, go ahead.
No, I was just going to talk about the competition in general, like in regards to if this will actually happen or not. Netflix clearly dominates the market by far. They're willing to spend the most amount of money on content. I feel like they have the most aggressive strategy. They're going after the international market, like all of those things. They also are profitable and like they're one of the only profitable streaming.
Oh, really? I didn't know
Yeah.
they're the only profitable.
Yeah, because I was looking at, I think Disney, their profitability is apparently extremely fragile. And apparently, I was on all these Reddit threads reading about this, and apparently Disney Plus, like Bob Iger is like really trying to prop up how Disney Plus is going, but under the hood, it's really not going well because they're not willing to pay up. They're also getting like these pay to deals, but that's not where the money is to be made. And so if they're not willing to invest in it, then they also aren't seeing the returns from it.
Yeah, I canceled my Disney Plus.
Really, I only pay for it as part of like the Amex free subscription thing.
That is like one of the few reasons why they get money then.
No, it probably
Brianna
is.
had a whole thing trying to figure out how she could watch Tell Me Lies the other day. Was it Tell Me Lies?
No, it was something else.
Heated Rivalry.
Yeah, it was Heated Rivalry.
Because apparently it's like really good.
We
Bro.
both don't think it's good,
It's
but like
not
my little
good.
sister's obsessed with it.
Well, it took like number 2 spot in like best episode ever on IMDb, which is like really hard to do.
Which episode?
It's like the cottage eobsode in the end. That
I don't even know what
obsessed
that
with, Probably.
means.
I don't even know. I'm just
I
guessing.
don't know what that means, but
I also think
you really wouldn't like it.
Yeah, I was gonna say I don't think I would like a show like that.
I feel like you'd
Well,
get
not
so
to-
You would get so uncomfortable.
not because they're gay, just because they're making a
Yeah, I was
lot.
gonna say like wait, we should clarify. I'm not a homophobe, but
She's not a homophobe. She's just a prude.
oh my god.
Should I clip that? Back to Trump. Okay, I guess part of why he cares about this deal is because he also hates CNN.
Oh yeah.
So he
yeah.
keeps being like, oh, like CNN needs to be sold.
Yeah.
Yeah.
Okay, one more thing I wanted to say is between all of this, Matt Damon and Ben Affleck went on Joe Rogan's podcast, and there's this like sound bite where Matt Damon is like, yeah, like the way we make movies is like so different because like Netflix has told us like instead of spending a ton of budget on like some crazy action sequence at the end of the movie, spend it in the beginning of the movie so that you grab people's attention and like reiterate the plot line like 3 or 4 times in the beginning of the movie because you like to grab people's attention because like when you're watching a movie at home versus when you're watching a movie in a theater, it's a very different experience. You're competing for attention from your like phone, your laptop, your kids.
The attention economy back at it.
Yeah.
And that's when we were even talking about like when TikTok and YouTube consider their realm of competitors.
Yeah.
Like Maya's argument that everything should be considered.
Yeah. And like to be honest, like so then Netflix got a really bad rap from this because like he mentions Netflix as the people who said, oh, make sure you do these things when you produce the movie, which like is so funny because then in context of all of these deals, people are like, yeah, fuck Netflix, like they're making like movies terrible these days. But it's like any streaming partner who's producing a movie is going to make the same choices. It's not Netflix. It's like what streaming is like and how streaming has changed movies.
Well, it's what media is like.
Yeah.
Like every network does it.
Yeah.
We
I
do
was
it.
literally
Yeah.
gonna say we do it. Like we think about it in that lens too, because you have to grab people's attention.
It's a hook.
Yeah.
And
Yeah.
and he was saying that's why you have a lot of flashback sequences or flash forward sequences where you see some like crazy thing and then it's like flashback.
That
And
makes
you're
so
like,
much sense.
It's because like you want to know what happened.
yeah,
Right?
like in Tell Me Lies.
Yeah.
Oh my god, are you caught up?
No.
Oh, I
Are
watched.
you caught up? I watched 3.
Me too.
Wait, because like I hated episode 1 and 2.
Really?
I just thought they were
Well,
so boring.
We also were like, what are we watching?
Wait, did
Is
you
3
watch?
good?
3. Well,
But
okay.
that's just how the show is.
Yeah, I was
Yeah.
gonna say I thought 3 was good, but I think that's because 1 and 2, me and Annika watched together on the couch, so I wasn't multitasking at the same time. But 3, I was multitasking while I was doing it, so I
You
thought
were
3 was.
multitasking by the time we got to
Yeah, by the time we got to episode 2, I
Wait,
did start.
feel like it was
I
so
can't,
funny because I feel
can't.
like the first episode, Priya and I both felt like like for the sake of the other person, we couldn't do something else. Because I watched us both like not do anything else. And then as the second episode came on, it both devolved. Like she started going on her computer and I was like, oh, thank God I don't feel bad. Because like also some of the scenes just get so awkward.
They're just boring.
Not awkward watching with you. Like I don't feel awkward with you. No, I feel awkward with myself. Like I feel awkward to like watch like some of the Lucy Stevens scenes. I was like, this is such a hard watch.
Yeah.
It's awkward in the way where I'm like, I'm not enjoying watching. I feel like it's just
I think it brings
Lucy's
up my trauma.
humiliation ritual. Yeah.
Cool. Okay, should we move on to
Insurance.
the
next sexy
Again.
topic of the day.
Regular insurance instead of health insurance. I didn't realize you could get insurance for anything. Like once a controller joined our company, anything, he was like, you can get insurance for that.
Yeah. So we wanted to talk about Insurtech because insurance is a huge industry. We were talking earlier about how healthcare is a huge industry, but there is almost $2 trillion in annual premiums in the United States, which contributes to 3% of the US GDP. So even that, I was like, wow, that's a lot.
It's 12%.
Oh, really?
Yeah, 2 trillion is 12%. The number is that it's like twice as big as SaaS, like enterprise.
That's
SaaS.
insane. Yeah. So that makes sense why it's so big.
Yeah.
And it's also just one of those industries that is super legacy, has a lot of the same issues of like, you have to submit claims, you have to pay them out, you have to go through all of these different things. And so I feel like that's why they face a lot of the similar bottlenecks and issues that you see in healthcare. And it's also why it's a really good industry to go after if you can navigate all the regulation around it.
Well, it's also just like every policy you buy, actually, you're buying like that policy is like getting paid out to like 5 different parties. So like you have like the carrier, the insurance carrier, which is like, here's a policy of, here's your like health insurance policy, whatever. Like if this happens, I pay this much, right? Then they have reinsurance, and reinsurance is just like insurance for insurance companies in case like something catastrophic happens. And then you have the brokers on top, and the brokers are the people that are actually selling it. I mean, the reason why brokers exists in general is because like that, you would have like 4 or 5 different policies, and then they would help you get the best price across all 4 or 5 different policies. Yeah. But in the modern era now, because information is just so freely and readily available, like brokers are just taking a cut for no reason, basically.
Yeah.
And so that's why.
And it's their incentive to like upsell you on anything because they're just making a portion of the total deal. Yeah.
And so that's what like Corgi and WithCoverage are trying not to do. They're trying to be the entire stack.
Yeah.
And I think it's well, they're kind of different because Corgi is trying to be the actual underwriting company of the insurance.
But WithCoverage
and then WithCoverage is trying to replace the broker.
Corgi doesn't want there to be a broker at all.
Yeah.
In the process because they want to be where you have everything through.
Like we can get to it later, but part of the reason why I'm bullish on Corgi is because I think it's like an even more longer term play than WithCoverage, because WithCoverage relies on there being a broken system of where you need a broker. Mm-hmm. So basically, Corgi is the actual underwriter, and they're on the hook basically if something goes wrong. Like I'm pretty sure they're the ones paying out the claims. Was that your understanding of it too?
Yeah, they are, and that's like why they needed so much money. So that's one of the reasons we're talking about them today is because they just announced their $108 million raise to basically build.
Company.
Yeah, they're a YC company, and they kind of combined their seed and Series A into one round and just announced it together.
Yeah, because their seed was $6 million, and then they like went and bought a $35 million like insurance carrier company, and then was in debt, like were in debt, and then used the second set of money to pay that off. Yeah. But the reason why they had to buy that company is because that company has all the licensing to like give out insurance, and to go get that licensing yourself from scratch is like a really long process.
Right. And they just got it a few months ago, right? Like it was June or July of last year, I think. Yeah. But they're basically trying to manage the entire thing end to end, and they basically want to use AI like everyone wants to speed all of that up, because right now when you go through all of this to get to the point where you're even like underwriting, figuring out if someone should get an insurance policy and then underwriting it, it requires a bunch of manual intake, a bunch of forms, a bunch of calls, all of these things. And so by using models, and you probably know about this.
I was gonna say you probably know
too
about
from like Paraffin.
Yeah,
but they basically have to assess the risk, figure out what the coverage should be based on everything that they know about you, and then figure out what the premiums are.
Actually, it's like I think it's a little different. What they say on their like podcasts and like news appearances is that all these policies are papers, and turning a policy contract into like a machine engine is like really hard. And now with AI, turning natural language into a calculator basically is a lot easier. And so like in these insurance companies, you have a ton of, when you like go and pay out claims, you have like a ton of agents, like human agents, trying to figure out whether or not like how they can go through all these like loopholes essentially. And now if you can just automate that with AI, it's like easier. So I think like my guess is they're probably using like AI for underwriting, but like AI for underwriting is not like LLMs for underwriting. It's actually like machine learning, like traditional machine learning models that have like gradient descents or something. I don't really know. But and then like LLMs is like the like, which is like the like very flashy stuff that we see today. Is like the second half of it, which is like the claims and stuff.
Yeah, that makes sense. Yeah, because it helps with all layers. Like it'll help triage claims, like flag any fraud, do all of those types of things for them.
And then when you build everything AI native from scratch, you can build it faster.
Yeah. And everything just happens faster. And the other interesting thing is how all of these insurance companies make money. The key metric for insurance companies is the loss ratio, which is the claims paid divided by the premiums collected. And that is essentially how you figure out how much money that you're making. And so the hypothesis is that with Corgi, the loss ratio will be way better than what you see with like Lemonade, because apparently Lemonade, because they're a public company, and apparently they were losing 80 to 100% of everything. So they actually were like netting nothing. And they're at a net loss right now of like negative $202 million.
It's so crazy how you can create a humongous company, but then it actually just like generated no money.
Yeah, because Lemonade, sorry, I know we're going back and forth, but like Lemonade has had consistent revenue growth. Like last year they made $536 million and their net income is negative $202 million. So they lost like $700 million.
R.I.P.
RIP.
They also said for startup, the reason why they went after startup insurance is also because like the brokerage fee is anywhere between 20 to 100%. So there was like a huge margin that they could cut out there. I also wanted to talk about specifically like startup insurance. So startup insurance, I was like actually pretty confused what it was, but essentially you need like insurance for various of different things. So one for your like employees. So for example, like if an employee claims discrimination or harassment and there's like some sort of like payout or wrongful termination, insurance is where that like insurance comes in handy there. Another thing is like you need it for your like board members, because like there might be fundraising disputes, there might be shareholder claims or governance issues. So there's just like various things that can happen as a startup.
There's also like cyber insurance. Like there's all the insurance that every startup ever needs. Yeah.
There's also like insurance against your tech. So like if your tech causes like harm to somebody, and then you have to pay them out. It's basically like business insurance, but like more intense because it's like.
Has no one bundled that yet?
No, so that's what they're doing. And I think I'm sure there's like firms that sell it out there, but there's no like tech first based
like it would be the broker that like bundles all of them and gives it to you. Like that is what they would do. Yeah.
And it makes sense to start with startups to me, because startups probably just want, like there's certain things as a startup where you're like, I know I need this. I want what's industry benchmark. I'll pay you what you need to be paid. And like the founder does not want to think about it. And no one at the company has it in their job description to figure this out. So it's like either the founder doing it or eventually they're like, why am I spending my day doing it?
Yeah, and there's a lot of reasons to go after startups too. So one thing is right now, every single year, insurance is reassessed, and with Corgi they're doing it constantly. So they have like a model that's always evaluating the risk. And the reason this really matters with startups is because startups are growing so quickly. So
they change so fast.
Yeah, they change so fast. The number of employees you have to protect change so fast. The geographies or the types of products that you launch change. And so Corgi can adapt with a startup in a way that traditional insurance just can't do, which is also another huge benefit.
Yeah, I mean, I think it's a very smart move from them. One, just because of the relationships they'll have from the YC community. Yeah, I'm sure like every YC startup will buy.
It's just like what Brex did. Like it's the exact same thing.
Was Delve a YC company? I don't even.
Yeah,
I think so.
I think it was. Yeah, but like no, and it's literally like you get in early. When it's tiny, and then you just grow with them. Like it's literally perfect.
Yeah. I also don't think they have like a major competitor other than what's like already there, the incumbents.
One of the reasons that Lemonade hasn't succeeded is because they weren't as aggressive and ruthless with underwriting, and they were just like giving out claims to anyone. I mean, like we use Lemonade for our renters insurance, and it's literally so easy to get. They don't really check anything. But But yeah, basically the loss ratio is the key metric in insurance in general.
That makes sense. And then for companies like WithCoverage that are the brokers or the risk management platform, they basically want to help you find the right insurance. So they shop across Lemonade, Corgi, and then like more traditional legacy insurance players to figure out what would be best for you. And they basically find both where you're overpaying and where you're not protected, but based on industry standard, you should be. And they're saying that they're going to use AI to do this. It's pretty much the same thing you did with your lease when you put it in ChatGPT. It's not that different. And they basically say that the traditional broker model relies on the premiums we talked about, and they're going to have more of like what sounds like a traditional B2B SaaS model, or like fee, more flat fee. It's kind of like what Crosby AI is doing for contracts, where they charge per contract reviewed instead of per billable hours.
Yeah.
And they recently announced their $42 million Series B funding led by Sequoia and Khosla. So they have like tier one investors. And that makes sense because one of the two founders is JD Ross, the other is Max Brenner. And JD Ross founded Opendoor, which is now like a $7 to $8 billion company. And they basically get rid of the brokers in the real estate process. So if you want to sell your house today and you don't want to do this whole thing where you get a real estate broker, you have to stage the house, which takes a couple of months. You probably have to do a ton of like assessments with different parties to make sure there's no like mold in your house. I don't really know what they do. I've never bought a house. And then you have to wait as like someone actually buys your house, and you try to optimize for the price.
Yeah.
But similar to CarMax, Opendoor is like, we'll just buy it right now for probably like 10 to 15% under market price. I'm not sure.
Yeah.
And then you just sell your house like in a day.
Yeah.
With zero inefficiencies. Corgi would get my check because I think they're bringing AI to the full stack of insurance. And I also agree that YC is a really good place to start for a company like that. And then WithCoverage, I could see them doing well because they obviously have a great founding team and a lot of funding tier one investors. But I think ultimately they'll get cut out, like something like Corgi cuts them out. And so I wouldn't put my like own dollars if I was a VC into it compared to Corgi. Corgi also has an insane team culture. I feel like I see their tweets all the time. Like every time they launch a new product, I'm pretty sure they buy a new Corgi, and they all have like Corgi tattoos.
It's like, yeah, it's like they all have Corgi tattoos. Every time they get a new employee, they buy a new mattress for the office.
Wait, how many people work there? Do you guys know?
I don't know, but
Curious.
it's definitely like 997 or like 1237, whatever. Like like you dedicate your entire life.
That makes sense. I also think there are companies that scale out of that versus don't. Like I think Mercor is a good example of a company that successfully scaled out of that phase and having that phase.
Wait, I don't think so. Wait,
Wait,
really?
I think so.
Yeah.
They all used to sleep at the office every day.
I think Cluely is an example of a company where it's like TBD, but it seems like they're having a really hard time scaling out of that phase.
I didn't realize Mercor scaled out of that phase. Like I thought people still work a ton there.
People work a ton, but I feel like it's like SF startup, they work a ton. They don't like sleep in the office anymore. And technically they don't have to work 6 days a week anymore either. Like they made it a 5-day.
Because there's so
Yeah.
many, they have so many hundreds of employees.
Yeah.
Like people have kids. And you can't, like, you hit a point. I feel like you hit a point around maybe 200, if I had to guess. Maybe
Which
even
I think they have more than that in SF.
They have a ton of employees now. Like, I remember when I heard the number, I was like, what?
Yeah.
Yeah, they're like big. Like, I feel like they're a late stage startup at this point.
Maybe.
That's crazy. We've been following them since they were like 20 people.
Yeah, I know. It actually is kind of crazy. Yeah.
Okay, we're off to our hotel.
All right.
In the same city we live in.